This is an example of a two-handed technique for peripheral IV start. Once you've obtained consent from your patient and reviewed your order, you're going to go ahead and tie a tourniquet 1 to 2 inches above the antecubital fossa and find your vein. You're going to palpate for a vein that you're going to use. And then once you found your vein, release your tourniquet and gather your supplies. I'm going to clean the skin with a chlorhexidine gluconate prep. They come in all shapes and sizes. This one is a wand. The technique is still the same. You're going to scrub the skin for 30 seconds. You're going to clean an area bigger than the size of the dressing. Once the 30 seconds is up, you're going to go ahead and let it dry and get all your stuff ready for the IV start. You're going to reapply your tourniquet 1 to 2 inches above the antecubital fossa. You're going to use your dominant hand to hold the catheter and your non-dominant hand for vein stabilization and skin traction. You're going to approach the vein at a 10 to 45 degree angle depending on the depth of the vessel. Perform your venipuncture. You're going to get an early flash. You're going to lower and advance the entire catheter, and then with your non-dominant hand you're going to slide the cannula off the needle. Release your tourniquet. Hold pressure and remove the needle. Being careful not to wiggle the catheter around inside the vessel. And then you're going to flush your catheter to verify patency. It flushes easily and you don't see any swelling or infiltration. You're going to close your clamp. You're going to apply your clear dressing, transparent dressing, making sure that the insertion site is in the center of the dressing. If you need to tape, this is when you do it. You might want to tape your extension. Making sure that all your tapes do not cover the insertion site. And then last, you will label with the time or with the date and your initials. Time if you have room, but for sure initials and date. And do not cover the insertion site. And that is an example of a two-handed peripheral IV start.